Well, good day to you. This is Greg Downing with Texas Medicare Advisors here on the outskirts of Austin, Texas. I'm a licensed insurance agent specializing in helping people get signed up for Medicare and then find the right Medicare plan at the right price. Now, if you're like a lot of people I work with, you're 65 or older, and lo and behold, you're still working. And you're a little confused on exactly what you're supposed to do about Medicare. Well, I put together this little short video specifically designed for people who are turning 65 but are still working and are still on company benefits. Now, if you're like most of the people I talk to, you're a little confused, and then most of the stuff you hear, you don't know whether to believe it or not about all the penalties, and you got to sign up now or things are really going to get bad and cost you a lot of money later. Well, let me just share with you a couple of things. This is what I call the 4 Medicare myths. And number one is you've got to sign up for Medicare when you turn 65. That is not true. Also, Medicare is free. Woo! Well, it's not. Trust me. Also, Joe Namath actually knows what he's talking about. He doesn't. He does not know. He's a half-truther. And also, Medicare is simple. These are not true at all. I have discovered that Medicare is pretty much a yes, but business. And what I mean by that, well, should you sign up when you turn 65 for Medicare? Yes, you should. But if you're on a group employer plan, you don't want to. And Medicare is free. Well, yeah, part of it is, but not the rest of it. And Joe Namath, well, he's just a butthead. And I mean that in a nice way. Now, so everything's just very complicated. So what we're going to do is cover today is just what actually original Medicare, who's eligible, and how to sign up, what Medicare covers, what Medicare doesn't cover. And then if you're going to be working after 65, we're going to talk about what should you do. And also, what do I do when I want to sign up for Medicare when I retire? So those are the things we're going to cover today to help you walk through the process. So, if you're working past 65, here are the questions you need to ask yourself. On your health insurance, how much is it costing you? What is your premium? What's your deductible? What are your co-pays? What's your out-of-pocket maximum? And the other question is, do you have dependent coverage? Is your spouse on your policy? That makes a big difference. Also, are you using a healthcare savings account? Because there's different rules associated with that. So basically, all you're really doing when you're still working, you're in turn 65, you're trying to determine where can you get the best benefits at the lowest cost. Is that through work, or is that completely switching over to Medicare? And the only way you know how to do that is do a cost comparison, all right? And that's what I help folks do. So let's look at, first off, who is actually eligible for Medicare, because we're all eventually going to get there. And eventually, with Medicare, you become eligible the month you turn 65. Or if you have certain disabilities and have already been declared disabled, then you can get Medicare if you're under 65. All right. Now, Medicare has several parts. The first part that you have to have with Medicare is Medicare Part A. So Medicare Part A, that's your hospital care. Now, the good thing about Medicare Part A, it doesn't cost anything as long as you've got your 40 credits, which is basically 10 years of work, or your spouse has, and you can file on there. So it's free for the majority of people. Now, Part A does have a $1,600 deductible in 2023, and that's not for the whole year. That's per benefit period. So let's say that you went in February, you got a $1,600 deductible, you got to pay the hospital, and you went in July, you have to do that again, all right? And then there's weird things like you have to pay for your first 3 pints of blood. Really not sure how they came up with that, but a pint of blood is much more expensive than a pint of beer, so you don't want to be stuck with that. Also, if you're in the hospital for an extended period of time, you actually have co-pays that can get up to $800 a day. And if you're in there more than 180 days, which would be horrible, you don't even have coverage. All right. So, not a lot of people know that, but that is the way Medicare Part A works. So, it's free, but it doesn't cover anything, and you still have a lot of exposure there as far as what you're going to pay out of your pocket. Now, the other thing that you're going to need to get is Medicare Part B. Now, that's your doctor visits, preventive care. It also covers chemotherapy if you're diagnosed with cancer, need that, ambulance services, and other things like medical equipment. Now, if you're getting ready to sign up for Medicare, you can sign up 3 months before your 61st birthday month. So take advantage of that. The sooner you sign up, the better you are, as long as we want to make sure you need Part B. All right. And to sign up for Medicare, you actually go through Social Security, and you actually have to have a My Social Security account in order to sign up for your Medicare. So if you don't have one, go ahead and get one that has a lot of good benefits. I've got mine all set up so I can see what my benefits are going to be, but go ahead and take care of that. Used to, you could call them in, they'd sign you up, but they don't even answer the phone anymore. You could walk down, but that ain't happening anymore. So that's why you sign up for your Medicare Part B. Now, Medicare Part B is not free. So the standard premium is $164.90 this year, but if you make a lot of money, then they're going to charge you more. So that's the way the government works. The more you make, the more they're going to take. So that's an important thing we need to talk about if you're a high income earner. Also, Medicare Part B has a $226 deductible that you're responsible for, and that is an annual deductible. And then Medicare Part B pays 80% and you pay 20%, which sounds pretty good unless you get something that's $100,000 and you had to get in that ambulance and stay at the hospital for a while. There's no cap on that, so there's no out-of-pocket maximum. So the 20% goes on forever. So if something was $100,000, you got to come up with 20 grand. And if you're like most people, that's too big of a risk. So most people say, okay, I need some additional coverage. And so what they'll do is they sign up for a Medigap plan or a Medicare supplement plan. Same thing, two different names, just to make things a little more confusing. And what these Medigap plans do is they pay for the Part A deductible, the co-pays, they pay the Medicare Part B 20% co-insurance, and the only thing that the best Medicare or GAP plan doesn't cover is that $226 deductible per year on your Medicare Part B. But of that, once you get that, you basically have 100% coverage. All right. Now, one of the things you'll also need to get is a Medicare Part D plan. All right. And that's your drug plan. And guess what? Here in Texas, we only have 27 different ones to choose from. So how do you know what's best for you? Well, the only way you know which one is to give us your prescriptions, where you want to get your pharmacy filled, which pharmacy you want to fill them at, and then we'll run through the system and we can tell based upon co-pays and the premium which plan will be best for you. And that's the plan you want to get, because you can really waste a lot of money buying a plan that doesn't work right for you. Now, even if you do not take any prescriptions, you still want to get a drug plan, because if you don't and you get one later, they're going to hit you with a big penalty. And the plans are not that expensive if you're not taking any, range from $6 up to $100, and so we'll help you look at that. But you do not get one just because you're not taking anything, because that's what insurance is for. All right, now, additional coverage. Original Medicare does not cover, dental. Doesn't cover vision, glasses, frames, hearing. So if these are important to you, then you're going to have to get a plan that covers them or just pay as you go. Now, another thing that's very important to me, over time I've learned, is while Medicare and everything does cover cancer treatments, I've got several clients that are taking these cancer oral medications. They're $10,000, $7,000 a month. And even with the drug plan, it's still costing them a ton of money. So we recommend getting a little cancer insurance. It's not that expensive. It's like $1 a day. So if that happens, you've got a little extra money to pay for things. So that's another thing. Now, I urge everybody to start thinking about your long-term care. Why is that? Well, because Medicare doesn't cover long-term care. Nobody's just going to pay for your long-term care. And the reality is once we get to 65, 70% of us are going to need some type of long-term care. So if you look right there in the middle of that good-looking man there, that's my dad, Johnny Lee. He lived with me for the last 4 years of his life before he passed at the ripe age of 92. That's a picture of him at the adult daycare center here in, well, actually, that's in Round Rock, but the Age of Central Texas is an awesome daycare. I took him there 5 days a week, and that's Lauren on the side there. She ran it at the time, but an awesome facility, but guess what? We had to pay for that. And then prior to that, he and Mom were in Lubbock at the Red Redder Ranch for about 3.5 years, and that cost a lot of money that we had to pay for because he didn't have any long-term care. Luckily, he had some cash, but we burnt through a lot of that. So, people, if you've dealt with it with your family, that's something you need to talk to and get started on sooner than later because that's where you can spend a lot of your retirement money and then it's gone. So, something to think about. Start thinking about your long-term care plan. There's several things you can do. We help people evaluate those as well. And switching topics completely, Joe Namath, Dynamite, what are they talking about? Free. Well, those are Medicare Advantage plans. Now, what is a Medicare Advantage plan? Well, most of my clients prefer original Medicare, get a drug plan, Medicare Gap plan, and that way they can see any doctor, hospital they want in the country without a referral. All right, now, Medicare Advantage plan, that's where the government said, wow, we got all these people turning 65 and they're living forever. We need to shore up our Medicare. So how can we do that? And that's where they came up with a Medicare Advantage or Medicare Part C. And that's where they contract with insurance companies like Aetna, Humana, United Healthcare, Blue Cross. And they pay them a fixed amount every month to provide benefits similar to what original Medicare does. Okay? And so the thing that people don't like about Medicare Advantage plans is there's a lot more rules and regulations because remember, this is managed care, PPO plans, HMO, and the insurance companies want to make sure they make money and not pay out a bunch of claims if they don't have to. So what they do is through managed care, they're going to have, different networks. Can't just go anywhere. You're going to have co-pays for the majority of things. And then with the out-of-pocket maximum right here, depending on the plan, they're all different, but you could be out $6,700 per year if you had cancer or some really major issue come up. And so you could look at this. I'm not going to go through all this, but some of these plans could be canceled, replaced. A big concern with people is getting pre-certification to go get treatments. You have to do that with all these Advantage plans, not with original Medicare. And then not everybody is included, let me get back here, sorry, in their network. Like the Mayo Clinic's not in the Advantage Plans network, or neither is MD Anderson. So these are just things you got to think about. But a lot of people like the Medicare Advantage plans, and they understand that because the insurance companies are no dummies. They know how to offer more benefits at lower costs. So things that people like is that where original Medicare doesn't have, but these plans will have dental, vision benefits, hearing benefits, telehealth, other things. The main thing is a lot of these plans nowadays you can get at no premium, so that means you don't have to pay anything other than your Medicare Part B. And then some of them even offer discounts Of course, anything in life, you get something, you got to give it up. But they've really learned how to market these plans where they're very appealing, but you just have to be very clear about what you're getting into and getting what's going to be the best fit for you. All right, enough of that. So, what if you're staying on your group, you're not doing Medicare at this point because you've determined it's just a better deal to stay where you are on your company plan. So, a couple of things. If you've got a healthcare savings account and you or your employer is contributing to that, you cannot be on Medicare Part A or B. You cannot. Now, if you're not getting a healthcare savings account, you want to sign up for your Part B. Sign up for Part A, but not Part B. And I'll talk about that here in a little bit more. And you're supposed to stop contributing to your healthcare savings account 6 months before you sign up with Medicare, which can be difficult. And if you don't stop in time, you'll just have to pay a little bit of the taxes on that and maybe a little fine, but it's not that big of a deal, so don't worry too much about that. All right, now, what happened? How do I sign up for Medicare if I've delayed my initial enrollment period? Well, what you want to do is you're going to go through what's known as a special enrollment period, and there's forms you got to get filled. One is from your employer that shows you've had prior coverage when you turn 65, so you didn't have a gap, so you don't have to pay a penalty. You get that form filled out. You complete a form that says, hey, I'm ready to sign up for Medicare. You take that to your Social Security office or upload it, and then you will get signed up. All right. You want to do this as soon as you can because the Social Security office is still so far behind because so many people are turning 65, signing up, and COVID just kicked their you-know-what. So I've had people that it takes almost 2 months just to get them signed up from when they submit their application. So if there's any way possible, sign up for your Part A because it's no cost. That way you got a Medicare number. That just makes things easier when it's time for you to come out and switch to Medicare off your employer's benefit plan. Now, if you're probably just as confused as you started, have lots of questions, and that's cool. So what you want to do is find you an independent Medicare agent, not somebody that works for Humana or Blue Cross. You want to find an independent agent that's got a bunch of options and is looking out for your best interest and not the company's. And the thing about us agents is we don't charge a fee. We're paid, compensated by the insurance company to find you a plan that fits your needs and budgets. So if you don't have a good Medicare agent, I have an idea of somebody that might be able to help you. Old Greg Downing there. Texas Medicare Advisors. Look a little bit like Mr. Clean on a good day. But feel free to call me. Even if you're not going to move to Medicare, that's okay. I'll answer any questions you got. Be a resource for you. And when you're ready, just give me a call and we'll take care of you. Have a blessed day and hope this was helpful for you.